I've had loads of really fun experiences doing commercial research. I've enjoyed the process hugely, whether that be parts of travel, meeting new people that are like-minded, getting opportunities to meet people that work in a completely different sphere to me and work and think in a very different way. A particular highlight strikes me as one with my team, which was trying to get first patient, first visit for a commercial study where it was opening early because of time zones in India compared to the UK and Europe. And just being competitive, my competitive streak came through, our competitive streak came through with the team. So we decided to start at a ridiculous time in the morning, at 5 o'clock in the morning for consent, getting the patient lined up, getting the team lined up. We were all done and dusted by 7 in the morning and went out for breakfast, having succeeded. Got first patient, first visit globally. That was fun. In my first study, I would love to have known that it would all work out well in the end. It's quite a barrier of entry to start in research. You know, you need to have a team around you, you need to have nurses, you need to have trials coordinators, you need to have estates, you need to have the support of your partners, you need to have support of your work colleagues and managers. You're taking a bit of a punt. You know, it feels like you're taking a bit of a punt, but actually it will work out, it will be fine. Commercial research is better funded, generally, and that's important for a sustained trials unit, estates, salaries, resources coming in. They tend to be better organised, they tend to be smoother, and they tend to have a predictable pipeline going forward, which is not always the case with single academic research projects. Having said all that, I think we do about 50-50. The academic research is really important to us. Get hold of a protocol and just read it from cover to cover, understanding the whole thing, the whole process, because it is very repetitive. One protocol is not dissimilar to another. I think once you really, really understand it, then it makes it an awful lot easier. And I didn't have that opportunity first up. We continue to do commercial studies as a group because it's an important income stream. It's an important variety in our day jobs. Any job can be quite boring if you're doing the same thing every day. And doing a day of week of a different aspect of it, commercial research in this particular situation, this particular question, is really valuable. The staff love it, the nurses really enjoy it. I think again for them it helps retention and a variety in their working life. The funding that comes into the practice is important. That helps fund a couple of doctors, a couple of nurses, trials coordinator. So it brings extra resources in that we wouldn't otherwise have, allowing us to deliver a better experience to our patients. There's practical support, trial opportunities that come our way through the NIHR. Those are improving all the time. I think those have improved with the National Contract Valuation Review that's occurred, which has brought primary care more in line with secondary care and made commercial research particularly more valuable to primary care. Within the organisation, we've also had a couple of doctors that have done a Green Shoots programme. So this is first steps towards running their own studies and being a Principal Investigator for their own studies. And that again has been really helpful for developing the future of research. I'd like to continue to work with NIHR. I think they're really valuable for helping people to take the first steps and be guided in those first steps. They're also a really good opportunity to network with like-minded people in a locality and get to know other people in a locality, share ideas, share opportunities, and work together to deliver a research healthy future.